What's up, guys? Welcome back. We're moving into section 5, which is going to be all about the lower back. This is episode 1, so it's going to be about the bony anatomy in this region. So our lower back is made up of 5 lumbar vertebrae, and as we're coming down, including starting up in our neck and thoracic spine, these vertebrae are progressively getting bigger. They have to carry more load the further down in our spine they are. So you can tell looking at the images here that the lumbar vertebrae are quite a bit bigger than the ones we looked at up in the cervical region. And then take a quick look at just the kind of the general curvature throughout the spine. Our neck and our lower back both have curves that go forward. They're described as lordotic curves or a lordosis. In the thoracic spine, the curve is the other direction, and that is a kyphotic curve or kyphosis. Something else to note as we come down the spine is the orientation of the joints. In the neck and the thoracic region, they're on this angle that really allows for a lot of rotation, and you can go back and watch the videos about the cervical and thoracic regions. We got a little bit into the mechanics there and how that gives us rotation. But as we get into these lumbar vertebrae, the orientation is really starting to change. So you can see the joints here are more, rather than being kind of stacked like this, the way they are in the thoracic spine, that's kind of shifted to more of like this kind of movement. So we get more flexion extension through those lumbar joints. Now you can get some rotation there, and everybody knows that feeling of like popping their back. And what happens there mechanically is, so take a look at the image here. We've got a joint capsule around each one of these lumbar facet joints, and you have to stretch those joint capsules to get, so regardless of what movement, but definitely more when you're rotating. And it's not so different than, well, of course now my knuckles won't crack, but it's not so different than a knuckle crack. It's just, that's weird to think about because it's your lower back, it's your spine, but the same thing is happening. We've got fluid in all of our joints. Gas bubbles can build up, and that's kind of the indicator we get. It's like, man, I need to crack my back. And then you stretch that joint and you kind of reset it, and you get that crack from the gas bubbles bursting. So in these upper lumbar, really throughout the thoracic spine, and then include the upper lumbar segments or vertebrae in that, we're pretty stable through there. We don't usually have joint or disc problems in the thoracic or upper lumbar vertebrae. And when I say upper lumbar, I mean L1, 2, 3. The L4, 5, and we'll include S1 because it's really like the stuff in between. So L5 is most of the time our last lumbar vertebrae. So it's the stuff in between. It's the movement of the joints and what's happening with the disc. So L4-5 and L5-1, that's where we typically have issues. These are more mobile segments. So we end up moving a little too much, and just think wear and tear. We kind of beat up the discs, we overwork the muscles, we stretch the joint capsules a little bit too much. All that stuff can lead to irritation and various types of pain. So we're not going to dig super deep into the discs on this episode. I kind of, as I was filming this one, I decided to just make a whole nother episode that is about the disc tissue, because there's a lot going on there, and we can talk more about the mechanics of, why we end up with disc bulges, disc ruptures, herniations, all the 10,000 different names that we have for disc injuries. So look, I'll call that episode 1.1 or something like that. And I'll post that one as quickly as I can after this one, before we move on to the second episode, which will be about muscles in the lumbar region. The episodes about the bony anatomy are typically the simplest ones. The main takeaway here is, the curvature that we have there, the orientation of the joints, and we'll also talk about some of the ligaments that we have in our lower back as we do that episode that's about the disc. So that's going to do it for today. Of course, as usual, if you guys have questions about any of this stuff, feel free to reach out. Stay tuned for episode 1A that'll be about lumbar disc tissue. And then we'll go into episode 2 after that. That'll be about muscles. Then episode 3 is about nerves in the region. And then episode 4 is about self-treatment and exercise. Now, let me throw an extra caution in, and I'll reiterate this in episode 4, but lower back is not the region to ask Dr. Google or take any of this stuff as prescription for you, because there's so many different things that could be going on, and sometimes the perfect exercise for me would be the last exercise you should do. So keep that in mind as we head towards the self-treatment and exercise episode. All right, thanks for watching, guys. See you soon.